Can you give an overview of what you'll be speaking about at our upcoming second annual Jack Cogan lecture on December 6th, which celebrates Mr. Cogan's commitment to physical activity and health?
Sure. Yeah, I'm really looking forward to it. And we are going to talk about the synergy of salutogenic science, and health is rarely about just one thing. So how do we create a unique synergy for each human being? We all want that silver bullet. There is rarely a silver bullet, and it's more like silver buckshot. So we're going to talk about how many different areas can become synergistic to influence the outcomes and the health and resiliency of each person we see. I watched the wonderful lecture from last year on exercise, and I thought I'd focus more on dementia. When I'm sitting with a patient and I say, "Hey, you should, eat better to prevent a heart attack," that works a little bit. But if I say, "Hey, you need to eat better to retain your mind," better motivation. I think maintaining our mental capacities, our memory, our cognition is really an important motivator. So I'm going to use that. There's been some fascinating research that's come out in the last 2 years that we'll explore for a pragmatic, scientific view of longevity and the mind. But then we'll use that to create a process and dream together towards creating a salutogenic process for our healthcare delivery system.
Okay, well, we look forward to that. That will be on December 6th. So thank you for that. So just to finish, you're very visionary, and it's kind of contagious. So I really appreciate that. And I'm just thinking, what is your hope for the field of integrative medicine? Do you have any comments, aspirations that you'd like to share about that?
Well, I remember the first day of the fellowship back in 1999, Andrew Weil asked us to define health. And, a lot of us conventionally trained doctors had a hard time doing it. I think we're getting better at it. And I think we realize that each human has their own definition, and we need to first listen. And that's true for listening to humans, and it's important to listen first to communities and then use our science in service of their best outcome. A lot of times we just project our science before we listen, and we were given 2 ears and 1 mouth to be used in that proportion. And so I think the future of integrative health will really focus more on this salutogenic science. I think the next term is health and healing oriented medicine or value-based care. So value is better health outcomes at a lower cost with a better patient experience. And CMS, Center for Medicare and Medicaid, wanted to start paying us for this. And I think this is a tremendous opportunity for integrative health to be leaders in value-based outcomes.